Hello everyone. In this video we're going to talk about kidney disease or renal dysfunction. In other words, we're going to look at what happens when that beautiful filtering mechanism I described in the previous video doesn't quite work the way it should. Let's begin with chronic kidney disease. And already with chronic kidney disease, you recognize the word chronic and know that this is something with relatively slow onset that goes on for quite a while, right? Now, the reality of chronic kidney disease is we are all losing kidney function. Basically, by the time you get to be about in your late 20s or early 30s, you're losing nearly 1% of kidney function per year. That might sound scary, but realize you have a lot of excess kidney function, so losing a little bit per year is really no big deal, and your kidneys are, as long as you take care of them, going to last your whole life without a problem. But we do lose a certain amount of kidney function per year. Chronic kidney disease is when that rate exceeds a normal rate to the point where the kidneys start to dysfunction before you die of other causes. Okay, what kinds of things can chronic kidney disease cause? Well, I don't like talking too much about the specific clinical stuff in this class because this is more of a class on broadly how the body functions. But at this point, you should be able to connect the pieces together. Among other things, it should make sense to you that, for example, a low red blood cell count, which is a form of anemia, may be the result, and poor perfusion. Why? Well, because the kidneys are actively involved in sending the signal, EPO, that tells the body, the bone marrow, to make more red blood cells. And so if the kidneys aren't functioning properly, then that signal doesn't get sent properly and you start running low on red blood cells. In addition to that, it can throw off your blood pressure, and that can lead to poor perfusion as well. In addition to that, you might have poor bone health because the kidneys are actively involved in managing calcium, phosphorus, vitamin D. These are central to the reproduction and healthy rebuilding of bone tissue. Remember, we talked about bone being active tissue that's constantly in the process of being rebuilt. So if that's not being managed properly, then you can easily see that kidney disease might lead to poor bone health. Brittle bones, for example, would be potentially related to kidney disease. What can then cause kidney disease? Well, some of this should make sense. Diabetes is a very significant cause of chronic kidney disease. Well, that makes sense too, because diabetes means a lot of glucose, a lot of sugar in your blood. Your kidneys have to deal with the osmotic potential of that and the effect on the glomerulus, that is your filtering mechanism of having all that sugar in there. That's going to lead to stress and damage on the kidneys. Hypertension, high blood pressure, that one can cause chronic kidney disease too. And that makes sense because your blood is being filtered actively through the glomerulus, right? Through this sort of mechanical filter. And if the pressure is off, if the pressure is too high, that's going to do some mechanical damage potentially to the glomerulus, and it's certainly going to continue or cause dysfunction in the filtering process. So that makes sense. You may have some genetic, by the way, predisposition to kidney disease. So we know that kidney disease can run in families. So there's the potential inherited factor. What else? Drugs and toxins for sure. The kidneys are responsible for filtering out toxins like drugs, for example. So if you expose the kidneys tissue to a lot of toxins, that's going to do damage to the filtering mechanisms, right? Think of it this way, just like a water filter or something. If you're using a water filter and you're putting really dirty water through it, it's not going to last as long as if you're putting cleaner water through it. The same thing, if you've got a lot of toxins and a lot of waste in your blood, then your kidneys are going to have to work harder to get that out, and that's going to strain your kidneys and potentially do some lasting damage. Autoimmune disease, we'll talk about this one, but there are autoimmune diseases, that is where the immune system misidentifies and attacks healthy cells. That can be related to kidney disease. And other things too, glomerulonephritis, which is a form of autoimmune disease, I suppose. So those are the ones that off the top of my head certainly matter. There's also the potential for congenital, I suppose, kidney disease. That is, say, you could be born with a defect in your kidneys that causes chronic kidney disease. And then there are elements of diet and lifestyle choices that can affect the health of your kidneys. So some foods that stress kidneys, certainly a big input of salt. That one can stress your kidneys out a lot, and that makes sense. Your kidneys have to filter out that salt. That's going to strain the process. Fats, high potassium foods, and high phosphorus foods. Now, that doesn't mean you should avoid high potassium food. Potassium is good for you and you need it, but certainly if you already have some kidney disease or kidney dysfunction, high potassium food is going to add strain to that. Those would be things like, I don't know, avocados, bananas, dried fruits, potatoes. These can stress or weaken kidneys, taken in excessive amounts. High phosphorus foods would be principally dairy, beans, and some nuts have high phosphorus in them. So if you had kidney disease, you might want to avoid those. One big one that in hindsight I should have led with is dehydration. If you don't provide enough fluid to flush out your kidneys, and by the way, that fluid has to be healthy fluid that allows your kidneys to continue to function and flush. Excuse me. So, if you're taking in, for example, alcohol, that doesn't count as a fluid because now your kidneys need even more water to flush out that alcohol toxin. If you're talking about caffeinated beverages, that doesn't necessarily count either because your kidneys don't have to work hard to get rid of that caffeine, and so you still need more water. So basically, healthy and regular amounts of hydrating fluids, principally water, are going to be necessary to keep your kidneys healthy. And if you allow yourself to get regularly dehydrated, that's going to stress your kidneys, and that's going to be problematic. All this should make sense, right? And I'm not saying this so much as lifestyle choices, like, I'm trying to influence you to live a healthier life, but rather I want you to understand how the system works. And understanding some of the causes of kidney stress and kidney disease allows you to understand how the system works. Bad lifestyle choices are obvious here. So excessive use of drugs, excessive use of over-the-counter medications, herbal treatments. Often people take these herbs that they think are healthy, that somebody gave them as a friend gave them and said, oh, this is going to give you more energy or whatever. Your kidneys have to work hard often to get those particular elements out of your body. Dietary supplements can have the same effect. Too much sports or energy drinks. So you might think that these sports drinks or energy drinks are your friend, but they have a lot of electrolytes in them that, again, your kidneys have to deal with. So honestly, if you want to be a friend to your kidney and you really want to take like a sports drink, mix it like 2-to-1 with water. So for each bottle of Gatorade you drink, mix it with 2 bottles of water, and then you're about the right level. They put a lot of extra stuff in these sports drinks that you don't really need, including a lot of sugar. But nevertheless, you need water to process all those electrolytes you're taking in. And then crazy, stupid diets like, high protein diets, high fat diets, etc., can also stress your kidneys. So you want to avoid kind of fad diets and stupid ideas that somebody on TikTok came up with. Okay. What other kinds of dysfunctions are there of the kidneys? Well, there's glomerulonephritis. And you can imagine what glomerulonephritis means just from the term. This is an inflammation, itis, an inflammation of the nephron due to an infection that is going to affect the filtering action. So remember what the nephron is, right? That glomerular nephron is that mechanical first step, that filtering element, right? And it's got sort of reticular or like a web-like filtering mechanical mechanism there that keeps out the proteins in the red blood cells, but allows smaller things to go through, and then we selectively recover some of those elements, right? We talked about all that in the last video, so if that doesn't sound familiar, review that. But anyways, there are a lot of different infections that can damage this, that can create damage to that mechanical filter, either by clogging it up or opening it up. And neither of those is good. So like a bacterial infection can cause some real problems there because the bacteria is going to grow in that glomerulus and affect the mechanical filtration. Bacterial endocarditis, that is to say, a bacterial infection of the endocardium that we talked about in a much prior video, for whatever reason, is often associated with kidney disease. It reappears in the kidneys. This should make some sense. Even though we don't know the exact mechanism, it should make some sense because the kidneys are responsible for filtering all this stuff out. So whatever bad things you've got in your body, there's a decent chance it's going to end up in your kidneys. And when it does, what we're going to have is some version of the inflammatory process in your kidneys that's going to bring in macrophages and scar tissue and all that kind of stuff. And scar tissue is not good. Macrophages are going to eat things. So kind of two ways that this can go, if you'd like, is you've got, let's say, a bacterial infection that hits your glomerulus, and now you've got macrophages that go out of control and eat away at the filtering mechanism, creating holes that are too big, or you've got scar tissue that comes in and blocks the holes, and now you aren't filtering properly because the holes aren't big enough, right? So big picture, those are sort of kind of two different ways it can go. A viral kidney infection is certainly possible. So a viral kidney infection like Hep B, for example, or Hep C is going to cause inflammation of the glomerulus and damage to kidney tissue. HIV commonly causes glomerulonephritis as well. So glomerulonephritis is a broad term that just means you have an infection of the glomerulus in your kidneys, the filtering mechanism in your kidneys that causes inflammation, and the result of that inflammation is going to be the inflammatory process that could lead to damage to the filtering mechanism, either by tearing it away and making it not filter enough, or by clogging it up and making it filter too much. Usually the former. Okay. What would be the symptoms of this? Well, we could expect all kinds of things, right? And if I gave you time, you might come up with these. Like one of them is going to be swelling, maybe around the face, the eyes, the legs, the ankles are going to swell up. Why? You've got imbalanced tissue. Remember, the kidney's role, one of the key roles, is to balance fluids in your body, right? And if you've got too much fluid, and especially if you've got a whacked osmolarity in that fluid, then you're going to end up with fluid where you don't want it. And your ankles and your legs might get really swollen, your face might get really swollen, just because your fluid balance and your osmolarity balance are off. That's what the kidneys do. They maintain that balance. You might get, I don't know, something crazy is foamy urine. So if you ever get foamy urine, one possible cause for that is that you have proteins in your urine. Now, the kidneys should stop proteins from getting in your urine. But if you had glomerulonephritis and it damaged the filtering mechanism and created bigger openings, bigger fenestration than should happen, then those large protein molecules can get through the filtrate and they will go through the tubules and go out your urine, and now you got protein in your urine. Remember, I mentioned in the previous video that checking for protein in the urine is one way we check to make sure the kidneys are functioning properly. And if you have protein in your urine, it may get foamy because it's going to change the surface tension of the water and allow it to foam up in the same way that soap does, really. Blood in the urine, same drill, right? Red blood cells are pretty big. They should not end up in your urine. They should not be able to make it through the glomerular filter. But if the glomerular filter is damaged, red blood cells get through, and now you've got urine that's a little pink, brown, red. Those are not good colors for urine. If that's the case, you need to see a physician. You might have your blood pressure be whacked a little bit because the kidneys are involved in regulation of blood pressure. And in general, you might have fatigue, maybe even other symptoms related to sort of, weakness, etc. Why would you get that? Because you've got toxins building up. One of the roles of the kidneys is that it removes toxins. And if you've got toxins building up in your circulatory system, that's going to make you feel weak and that's going to make you feel sick. All right? So I want you, the reason I'm pointing those out is I want you to not just memorize, this is what the kidneys do, but think about what it means in your everyday life so that you can better understand later if you have an illness, if you have an injury, etc., how the pieces come together for you and define your overall health. The kidneys aren't just something you study, they're actually in your body, keeping you healthy or not. And you need to be able to understand that and manage that. Remember, this course is sort of a user's guide for the human body as well as just a general physiology kind of approach. Okay, what else can happen to the kidneys? Autoimmune, talked about that one, right? This is where your immune system misidentifies healthy tissue as problematic or aggressor tissue and tries to get rid of it or attacks it. One that comes to mind is post-streptococcal glomerulonephritis. That is a mouthful. But at this point in the class, you should know what it means. Post-streptococcal means you had strep, and now it's after strep, post-streptococcal. Glomerulonephritis is what we talked about before. It's an inflammation of the glomerulus in the nephron. It's an inflammation of the filtering mechanism of your kidneys. How does this happen? Well, it's really kind of cool and crazy. Here's what happens. Imagine you get something like, I don't know, strep throat. Some strep infection, but let's just make it strep throat because everybody's used to that one. So you have strep throat. You get better. And maybe 2 or 3 weeks after you have strep throat, you start having some other issues. Maybe you're going to have pain or something else. Maybe you're going to have unusual urination, etc. And the reason for that is you're probably developing post-streptococcal glomerulonephritis. Why? Because you've got strep. Your body fights off the strep. How does it do that? Your immune system attacks it. And you know what happens is you get antigen-antibody complexes. Antigen is the strep. Antibody is the thing you connect to it to glom them all together and identify them for your immune system, right? These complexes, these combined large clumps, end up in your kidneys. The inflammatory process happens. This is why we talked about the inflammatory process earlier. And you remember all the steps in the inflammatory process. And you remember one of them is that macrophages, specialized cells that eat up other cells, are going to go in there and they're going to chomp away at all of that bad stuff, all of those antigen-antibody complexes. But those macrophages, those are not going to be particular. They're just going to chomp away everywhere. And when they do that, they're going to damage that filtering mechanism. In other words, they're not going to just chomp away at the antigen-antibody complexes. They're going to chomp away at healthy tissue around it, and they're going to make bigger holes than should happen in that filter. And as a result of that, red blood cells, proteins, and other things that should not be able to get through that filter are going to be able to get through that filter, and you're going to have blood in your urine or some other effect, foamy urine or whatever, right? You get the idea. So it's interesting because you have one infection, your immune system adequately deals with that. The waste products, if you'd like, of that infection, or the byproducts of that infection, end up in your kidneys. Your immune system recognizes that, activates cells whose job is to get rid of such problems. They over-respond. There's the autoimmune part. They over-respond, damage healthy tissue in the surrounding area, and now you've got damaged kidney function. Post-streptococcal glomerulonephritis. Okay. Before going on, I should point out what kidney function means. So as we kind of evaluate all these things, we should realize that physicians regularly measure kidney function, and we measure on the scale, basically. Normal there is about 90, by the way. And the scale's units is weird, so I almost want to ignore them, but I'm going to tell you anyways just to show you how weird stuff could be. It's milliliters of filtration per minute per unit of body surface area. It kind of makes sense, right? How much filtering is happening by your kidneys every minute as a function of the size of your body. But we do that as a function of the surface area of your body, which is kind of weird. I think it actually is per 1.73 square meters of body surface area, whatever. The point here is that the units don't really matter that much, but 90 is considered a good, healthy kidney function. 60 to 90 is fair. Below 60 is not so good. Something like 15 would be really bad and close to kidney failure, or actually it would be kidney failure. So we measure kidney function in that way. And what we're trying to get basically is a measure of the cleansing effect or the filtering effect of the kidneys. Realize we can't do it kidney by kidney. That is to say, we do this by measuring urine and seeing what particles end up out in the urine, so we can measure how effective we are at the process of filtration, but we can't isolate one or the other kidney. So at no point can a doctor tell you it's your right kidney that's really bad or your left kidney. Well, actually, at some point they can tell you, but not initially, just with these tests. They can't tell you that. We measure other things as well. So we will measure a breakdown product of plasma, which is plasma creatine. We measure BUN, which is blood ureic nitrogen. And this one's kind of interesting because it's the urea that is a breakdown of amino acids. And I remember before talking about nitrogen, I think. Yeah, I think we talked. Oh no, we talked about ammonia. Ammonia is related to blood urea nitrogen because it is the breakdown capsulation process of ammonia that leads to BUN. So basically, long version of that, we are measuring a breakdown product of amino acids to see how they are being excreted from the kidney effectively or not. Sometimes we'll measure like 24-hour urine volume and concentration. So you might have a situation, or somebody you might know might have had a situation where you have to walk around with like a bottle for 24 hours to see how much urine you're putting out and what kinds of stuff is in that urine. We will check for protein urine. We talked about that before. And we're going to just check for the presence of all kinds of potential waste products. Perhaps we'll check for the presence of white blood cells or red blood cells that should only be there in very trace amounts. If it's more than that, that's not a problem. And when we do this, we're checking kidney function. And one of the terms we'll often use, and I want to bring this up because it underscores one of the points about kidneys, is we'll say we have a normal renal reserve or a compromised or diminished or decreased reserve. And what's interesting about that is it underscores how capable the kidneys are. This is one reason that kidney function really is not as much of a killer of folks as other kinds of diseases, because the kidneys are capable of doing a lot more than we need them to do. So in fact, we have this great renal reserve, this great excessive capacity of the kidneys. And so frequently when we test this, what we'll say is we have a decreased reserve, which doesn't mean that your kidneys can't function well enough to keep you healthy, but rather you don't have as much surplus capacity of kidney function as you once had. It's kind of interesting, right? We don't do that with anything else. We don't talk about the heart and say, oh, the heart's got all kinds of extra capacity and now you've lost some of your heart reserve. There is no reserve. If you lose heart function, you're screwed and you're losing capacity, right? Same thing could be said for many other organs. But in terms of the kidney, we got extra capacity. In fact, about 1 in 1,000 babies is born with only one kidney. It's not that uncommon, and in that case, people can live a healthy life, as I mentioned before when I talked about transplants, with just one kidney. So we certainly have a reserve of kidney function. So that's chronic kidney disease. The other possibility is an acute kidney injury or failure. This is basically, frequently this is where we have sort of a worsening renal function that happens abruptly, so somebody has some kind of compromised renal function, compromised kidney function, or decreased reserve, and then suddenly things go south from there. And it could be the result of like an insult, like a severe dehydration. The person hasn't been drinking enough. This happens a lot with older folks that maybe have suffering some dementia and they aren't drinking adequately, and then they will lose significant kidney function just because they've had like, 1 glass of water in the past 3 days. Usually when that insult passes, the person can recover fairly effectively. However, there's also the possibility of acute kidney trauma. And I mentioned before, in fact, it's right here, that the kidneys are way back here, retroperitoneal, behind the peritoneal cavity, and under some of your rib structure, so relatively well protected. So trauma to the kidneys is not all that common, but trauma to the kidneys can be pretty significant. So I think actually like renal compromise occurs in something like 1 to 3% of hospitalized trauma cases. In other words, trauma is where you have like, a blunt injury impact or a car accident or something like that, or a fall from a height. And so you've got physical damage to your body. 1 to 3% of people that go into the emergency room for that have some kind of kidney injury. In other words, it's fairly rare because somebody can get hit pretty hard and really not have a problem with their kidneys because they're pretty well protected. Having said that, remember, children have less well protected kidneys, so in their case, that's a little bit more of a problem. And the other thing is that we only require a small portion, roughly a third, by the way, of our kidneys. In a healthy kidney, we only really need about a third of the capacity of our kidneys. So we have significant renal reserve, significant kidney reserve, which means that if you do lose some function as a result of an acute kidney injury, it may not be that problematic. And death due to a kidney trauma, pretty unusual. Okay. Other diseases that are out there that kind of can come on, well, I should talk about uremia. Uremia is an accumulation of toxic waste and a loss of electrolyte balance in your kidneys. This can create all kinds of symptoms that you would expect, right? Weight loss, abnormal bleeding, nausea, fatigue, swelling, as we talked about before, all the things we talked about before that might happen as a result of kidney issue. Interestingly, we might also get uremic encephalopathy. Remember what encephalopathy means? I've used the word before, but this is basically fluid building up around your brain that creates problems. Why might that happen? Because your kidneys aren't functioning properly. You've got a lot of uremia there, and that is building up in your cerebrospinal fluid, which is leading to injury to your nervous system and your brain. This can lead to everything from just lost focus, concentration, what we could say compromised mentation, compromised ability to think, to actually causing a seizure. So that's uremic encephalopathy. And it can also lead to coagulation failures. That is to say, sometimes what happens is uremia can lead to actually internal bleeding and a lack of proper coagulation of your blood. At this point, you should say, yeah, that totally makes sense. The kidneys are involved in managing electrolytes, including things like calcium. And I've already mentioned to you that several electrolytes, most notably calcium, are necessary for coagulation. If the kidneys aren't properly managing the electrolytes, then coagulation may not happen appropriately. Okay, what do we call kidney failure? Basically, because we've got so much reserve, we don't say somebody's in kidney failure until they've lost something like 85 or 90% of kidney function. Once their GFR, glomerular filtration rate, their kidney function rate that we talked about before, drops below 15, we say they're in kidney failure. I mentioned that previously, but I wanted to highlight that point. And at that point, when they're in kidney failure, we need another way of filtering their blood. And that's where dialysis comes in. Dialysis is the artificial filtration of blood because of a failure of the kidneys to be able to do so. Sometimes it's temporary. Somebody has an acute kidney injury or insult, a disease that causes an insult and problems in the kidneys, and they have to go on dialysis temporarily. And we hook them up on a machine that is basically a blood filter. Here's an image of what it looks like. It's a large machine that's going to mechanically filter your blood, mechanically do at least part of what the kidneys do. Sometimes people need to do this for a long time if somebody has kidney disease. This is basically like an artificial kidney. Worth noting is in order to do this, we need access to the blood. Remember, we got a major artery that comes down to the kidneys and then a major vein that comes back. We can't tap into that. It is way down beneath your abdomen. We can't just simply connect a hose to where your kidneys go. So what we do is we create a fistula. We created an artificial, synthetic, typically, passageway, a tube between a major artery and a major vein that we can connect into to put in a filtering machine. And this person that is on this machine might have to go to 3 or more sessions a week. Remember, I told you at the beginning when we started talking about kidneys that you might survive a couple of days if your kidneys stop functioning, maybe a little bit more than that, but not much more. As a result of that, we don't want to go more than about 2 days, maybe 3, without some dialysis, because we'll start to see the effects pretty significantly after that. So a few times a week, a person's need to go into a dialysis center, be connected to this machine through the artificial fistula that's been surgically implanted in their arm. Here's an image of what that looks like. And take part in basically mechanical filtration of their blood, what we call hemodialysis. Hemo referring to blood, of course. The sessions themselves, 3, 5, maybe up to 10 hours. I would say 3 is the absolute lowest. 10 is probably the absolute highest, depending on the need of the patient. So my point here is, you don't want to get there. That is rough. Every couple of days going into the center, having this artificial thing attached to your arm and having to have your blood filtered for you mechanically is not great. There is another option, which is peritoneal dialysis. Remember what peritoneal means? It's that abdominal cavity. In this case, what we do is we take a dialysis fluid, a peritoneal dialysis fluid, and we pump that into the abdomen. And it basically exchanges with your bodily fluid process and creates a cleansing of your blood. It's what's called a diastolate. So a diastolate solution that we're going to pump into your body, and then that over the course of about 3 to 6 hours is going to cause some filtration. It's maybe not as extensive and complete as hemodialysis with a machine, but one nice thing about it is it allows you to live your life a little bit more normally because you can do this at home. And some people can even manage to do this while sleeping or while resting or watching TV or something like that, and otherwise live, a normal life. I mean, you might be able to work from home or do some other things, I don't know. But my point is it is less disturbing than having to go to a dialysis center for several hours every couple of days, even though it's still pretty significant. So that's peritoneal dialysis. Other injuries that might be related to kidneys. Well, one's obvious, and maybe you've even asked yourself, why is Hase not talking about this? I've heard about this. Kidney stones. This sucks. You can have some of those electrolytes. Remember, the kidneys are filtering out these electrolytes, these minerals, right? And these minerals might build up and aggregate into a structure. They might glom onto each other and create basically a rock in your kidneys. That's not good. These can be of different sorts. They can be something like calcium oxalate. Calcium oxalate sucks because it's irregular in shape. It's got projections to it. So typically when you have a kidney stone that's calcium oxalate like that, you're going to get some blood in your urine because it's going to tear through the tissue and cause bleeding in your ureter, in your kidneys, etc. That's going to flow down your urinary tract. You could have triple phosphate, which is, ammonium, magnesium, and calcium phosphate all combined together into like a crystalline kind of rough, think of like a salt crystal kind of looking thing, only more yellow-brown. Here's some images of what the different ones look like. And you can see there, some are very small, some are large, some form a lot of small little pieces, some form larger pieces, some are smoother, some are rougher. You don't want the rougher ones, you want the smoother ones. All of these can be, really problematic. They can create bleeding, they can create intense pain. Some of these, if they're larger, need to be surgically removed. Others are fairly small and smooth. So like urate stones tend to be hard and smooth. They are basically uric acid, stones made of uric acid, and they will kind of aggregate together in a smoother surface, which may be passed. It's going to hurt, but they may be actually passed all the way through your urethra. The triple phosphate tend to be very rough, and they create like staghorn kind of. What I mean is they harden in the pathways in which they form, and so they take the shape of the pathways. So they'll have like branches that stick off and different pieces. This is why we say staghorn. They look like antlers a little bit. You can imagine that's not something you want passing through your body. One possibility, short of surgery, and a little better than just hoping that they pass and experiencing the excruciating pain, is lithotripsy. Lithotripsy is to take the patient that has these stones, put them in a tub of water. I think they have some solutions in the water as well. And then basically take some focused sound waves and bombard the stones with these focused sound waves. It would basically like a sonogram machine, but extensive, beating up the stones and hopefully creating enough trauma to cause them to break up and be able to pass through your urinary tract less painfully. Having said that, the lithotripsy itself is fairly painful. So the process is not without pain. Having your stones beaten like that in and around your kidneys is not going to be a pleasant process. Speaking of not pleasant, another possibility is polycystic renal disease. Here's a picture. Yeah. So just from the name, this is not good. Polycystic, which means a lot of cyst, kidney disease, what sometimes called a PKD. It's a genetic disorder where you grow these large cysts, fluid-filled sacs is what a cyst really is. Fluid-filled sacs all over your kidneys. You're going to lose kidney function as a result of this because it's going to displace healthy tissue, obviously. It's going to affect other organs, including your liver, your pancreas, potentially even your heart. So there's some unpleasantness to this beyond just the damage to the kidneys. It's going to potentially be coupled with high blood pressure because you're having trouble having filtration pass through your kidneys. It's going to create gastrointestinal issues because it's going to create pressure that's going to cause you to feel constantly full and you're not going to want to eat. I'm trying to think of other symptoms. It's going to relate to headaches because of the high blood pressure resulting from this, and potentially, of course, infection of the kidneys and the urinary tract. So this is a real polycystic renal disease. Is something you really, really, really don't want. But again, it's not a contagious disease. It's a genetic disorder. Okay, renal tumors. That's also a possibility. These can be benign renal tumors, that is, say, renal tumors that are not cancerous, but that's unlikely. Typically, the tumors that form in the kidneys tend to be cancer. So malignant renal tumors, which we sometimes call nephroblastomas, nephro meaning the nephron, blastoma, you know. These can sometimes happen in children that are very young, and when they do, the prognosis is not that terrible. If you have a child that has these, basically it's also going to mess up their fluid balance, so they can sometimes get bellies full of fluid. They can sometimes have blood in their urine, so they'll have like distended bellies. They'll look fat, but it's not fat. It's just fluid building up in the abdominal cavity. But nevertheless, overall, they have a pretty good prognosis. Renal cell carcinoma in adults, which is the version of kidney cancer in adults, prognosis, not very good at all. Tends to spread very, very quickly, so that's a bad deal, and you're unlikely to have a good outcome from that situation. And both of these are associated with significant pain, as you can imagine. Hematuria, that's blood in the urine. Hema, blood, urea, urine, so blood in the urine. Other possibilities that are interesting and worth thinking about, urethral strictures. This is interesting because this is the result of that inflammatory process to some degree. What it is a narrowing of the urethral pathway, what we call the lumen, the inside passageway of any tube in medicine is called the lumen. It's the narrowing of that lumen passageway as a result of fibrous bands that are sort of like dense scar tissue. It could be congenital. You could just be born with this and you know, luck of the draw kind of thing. It could be related to an STD. So you've got a sexually transmitted disease that triggered an inflammatory response, that triggered macrophages and that whole thing we talked about before. And what you end up with is thick bands of scar tissue that basically block the passage through your urethral structure. It could be maybe from an infection. It could be more likely from a surgery. So this is one of the risks of surgery or trauma in that region. So if you had trauma to your bladder, your urethra, your ureter, whatever, then you could get these scar tissues that are basically blocking the passage of filtrate urine out of your body. And related to that, you could have a urinary tract infection. If you're a woman, you probably have had a UTI because, again, women are more susceptible to UTIs than men are, unfortunately, or whatever. But anyways, it's a bad deal that the woman's physiology has a relatively small urethra and therefore a little bit more access for bacteria and other kinds of contaminants. But a UTI, to be clear, isn't just an infection of the bladder. It's an infection anywhere along the urinary tract. So it's a urinary tract infection, which means it could be the bladder, it could be the urethra, it could be the ureter, anywhere along that path, the kidneys themselves. But an infection there is not going to be good. Probably the most common one is E. coli, which is not a great thing. And then what you need is antibiotics that are going to knock back that infection. I would say this, though. This is why I'm bringing it up, not just because I want to talk about what a UTI is. Here's why I want to bring it up. If you think you have a UTI and it feels like your last UTI, don't presume it's a UTI. because there's some other very bad things that can feel somewhat like a UTI that are worth ruling out and could be life-threatening. It could be, for example, an ectopic pregnancy. It could be a cyst, and that cyst could twist or turn and cut off blood supply to some of your organs, or, even worse than that, burst open, causing you to have a life-threatening situation in a matter of minutes. We're going to talk about this more when we talk about GYN issues, but I just wanted to point out here that even if you think it's just a standard UTI, it's worth seeing a physician to rule out some other serious life-threatening situations that could feel a little bit like a UTI, but are much more problematic than a UTI and need a much more care than just a standard antibiotic. Okay, on the male side, I talked about this before, but I got to bring it up again. Enlarged prostate. The prostate, again, is basically a walnut-sized organ that is there to basically provide components called prostatic fluid, but components to semen beyond the sperm. The sperm obviously comes from the testes, but the rest of the semen comes from the prostate. And with time, you get what's called BPH, or benign prostatic hyperplasia. Hyper means high. Plasia means reproduction or creation, like plastic, something that builds and changes, etc. So benign means it's not cancer. Prostatic means it's in the prostate. And hyperplasia means it's growing and building. In other words, your prostate is enlarging and it's blocking the flow of urine through your urinary tract. This can be significantly problematic and at times even requires surgery or other kinds of medical intervention. But for many men, let's say over the age of 50, what it means is they need more time peeing, they need more patience about their peeing, and frankly, as far as I know, no over-the-counter medication has been shown to be very effective at this. So whatever. For the men in the audience then, when you reach the age of 50 or you're already at the age of 50, or sometimes even by the age of your mid-30s, you can experience these effects and you're having trouble urinating, first, drink more water and keep drinking more water to flush it through. But then if you still have problems, you may have BPH. And if you do have BPH, don't waste your money on some over-the-counter voodoo medication or whatever. It ain't going to work. See a physician and get serious care and serious medication, or at least figure out how to live with the situation. Okay, that's all I can think of that is relevant and interesting to talk about in terms of kidney dysfunctions and diseases. So I think the next set of videos might be gastrointestinal systems. So I will see you then. You take care.